I've been in aging services for almost 40 years, and I've never been as alarmed as I am seeing the health plan now being considered in Congress. You know, it was so wonderful when years ago the ACA came into place and people 55 to 65 finally had affordable health care. Before that, people's health care, their insurance would, after being laid off or maybe divorced, would be, you know, $1,000 or more, or they just went without. So thinking that we might head back in that direction with this current bill, which allows insurance companies to charge 5 times as much for older adults as younger people, I just can't think about it. But the thing that's most alarming to me is changes to long-term care. This bill goes beyond health care and does away with the Medicaid entitlement. That's a huge change in our policy. Most people in America don't want to think about needing long-term care, and they sure don't want to think about paying for it. Most think Medicare will cover their nursing home cost. More than 75% of Americans think that. But it doesn't do that. Medicare will cover time in a nursing home right out of the hospital, but it's Medicaid that covers nursing home costs for the long term. It covers home care. It is the guaranteed payer for nursing homes. And most states like Ohio offer a lower cost home care benefit. It's also paid for by Medicaid. A lot of people know it as Passport. Medicaid is the guaranteed payer for all of us who can't afford long-term care or outlive our savings. And that's not a hard thing to do when a nursing home costs $80,000 a year. So 60% of all nursing home care in the country is paid for by Medicaid. In Franklin, there are 52 nursing homes, and 10 of those have over 75% of their people paid for by Medicaid. So it's an issue for all of our families. The implication of what has been proposed are severe, with our growing aging demographics especially. With caps on Medicaid and block grants, the states will have to cut cost-effective home care options and probably make it harder to get into a nursing home. This is a discussion Americans need to have, and that's not going to happen in the next 2 weeks or the next 2 months. It's a serious discussion, and I would urge you to ask our senators to reconsider this bill and let the sun shine on these important health care decisions that will affect all of us. And now, it's my honor to introduce a man who has always supported the older adults in our community through the Area Agency on Aging, support for the senior levy, and making Columbus a leader in the age-friendly cities movement. It's our mayor, Andrew Ginther.
Good morning.
Good morning.
It is a great morning to be with you today. Cindy, thank you so much. And to all of the incredible work. Tony, we are so thrilled to have you with us as well. Great partners at the city, the county. And how about, she's not so much a secret anymore, but the city's secret weapon, Fran Ryan, who is out and tremendous leader and great organizer for us. I'm thrilled to have the president of the Northland Community Council, Emmanuel Remy, join us, and all the amazing folks here at the Gilley Senior Center, a tremendous place, and so glad that President Klein and our great partner of the County Commission, Commissioner Marilyn Brown, is with us as well. You know, we're in a special place today where thousands of seniors take advantage of some outstanding programming, including arts, recreation, and fitness. In fact, I was just told that President Klein and I are going to be in a ballet class right after we finish up here this morning. Our daughters will be thrilled to see the images associated with that. Our senior population is growing more than any other age group. Central Ohio's population of 65 years or older is expected to double over the next 35 years. We currently have more than 5,000 seniors in Central Ohio living in nursing homes. They need and deserve access to health care. The latest version of the Senate's health care legislation will be devastating to our seniors, to our moms and dads, to our neighbors, and for those of us nearing retirement age, for us too. Health care is not a political issue, and it shouldn't be a partisan one. It's not every day that Governor John Kasich and I totally agree on the same position. That should take notice with folks, that if Governor John Kasich and I are on the same wavelength in protecting Medicaid and protecting those vulnerable in our community, it ought to send a clear message to Washington. But you know who has the power to send the most clear message? You. All of us as individuals engaging, calling our senators. Now is the time to help Washington understand Buckeye values. Values of taking care of one another, looking out for each other, and protecting those most vulnerable in our community. Governor Kasich sees it, I see it, Commissioner Brown, President Klein, all of our leaders here from the health community, outstanding leadership from our health systems, all in opposition to this. The American Medical Association, and the list goes on and on. AARP, so many great organizations that look out for us are all opposed to this, because this bill does nothing to improve access to health care. In fact, the changes that the Senate made make it worse. It breaks the Senate's promise to protect those with pre-existing conditions. Two major health insurance organizations, America's Health Insurance Plans and the Blue Cross Blue Shield Association, describe the current amendment for pre-existing conditions as, quote unquote, simply unworkable in any form. The single risk pool is in name only. It actually creates two pools, one for the healthy and one for sick people. Healthy people would move to less regulated, less expensive plans, while those with significant medical needs will have no choice but to stay in the comprehensive plans. Premiums will skyrocket for people with pre-existing conditions, including many seniors. Cuts to Medicaid will disproportionately affect seniors. Medicaid pays the cost of about 62% of seniors in nursing homes. Cuts of federal Medicaid payments to states will be cuts to seniors, not just in nursing homes, but those receiving home health care as well. So to talk more about the cuts and the effects the current legislation will have on our seniors, I'm thrilled to introduce, and I hope you'll join me in welcoming President Zack Kline.
Well, good morning, everyone. How y'all doing? It's a very vibrant crowd. I love it. I love it. Can't wait to see the mayor in his tutu. Yeah. Yep. It's going to be something else, everybody. It's going to be buckle in, buckle in, buckle in. The mayor touched upon something that I think is so important, and that is, health care is a fundamental right. Think about it. Without your health, you got nothing. Without your health, you got nothing. How can a kid who's sick study and get the education that he needs? How can a mom or dad who's sick provide for their family or get a job? And how can seniors who have given so much their whole entire lives live their best days with the joy and dignity they deserve without quality health care? And this bill, what is being proposed in Washington, D.C., is an absolute affront to everything we believe in as Americans. Everything. There isn't a day that goes by that I don't pick up the newspaper and I ask myself, what in the heck are we doing as a country? What in the heck are we doing as a country? And I think the poster child of that is taking $800 billion out of Medicaid. $800 billion. Now, just bear with me for a second on some of this math. If you're 60 years old, making $18,000 a year, not a lot of money, not a lot of money. 60 years old, making $18,000 a year, you'll pay $1,424 more than under the current plan. More. And if you're that age, 60 years old, making $42,000 a year, again, $42,000, decent wage, you're going to pay $4,500 more. Our priorities are all out of whack. Our priorities are all out of whack. We need to be rewarding the hardworking men and women of our country, the seniors that have put it all on the line, built this great country for what it is, given me the opportunity to stand here as council president, build a country that I have my 5-year-old and 2-year-old to look forward to the better days ahead of it because of people like you in the room, and we need to be protecting you, saving you, offering good quality health care for you, the disabled, the sick, children. And I just want you to know that the mayor and I and the county commission, we have your back. We may not have a vote in this matter, but we have a voice. And sometimes your voice is your vote every November. That we have to stand together, let Washington know, let Senator Brown know. I know Senator Sherrod Brown's with us on this, but we need to call and let Senator Rob Portman know that this is unacceptable and that we're standing with those who are less fortunate than us, those who deserve health care, those who want the opportunity for themselves, they want the opportunity for their children, and that we're all in this together because that's how we do things in the city of Columbus. So thank you so much for letting me share some words with you. And it's my honor to bring up my dear friend, one of the greatest 3 of the county commissioners, Commissioner Marilyn Brown.
Good morning, and I'm wondering why I didn't get invited to the ballet class now. Oh, right. I want to thank my 3 good friends, Council President Klein, Mayor Ginther, and Cindy Farson, and my good friend and colleague, Tony Carroll, who's here from our senior options, and so many others. Fran Ryan is here. This is such an important issue. I can't begin to tell you. You all know what an important issue this is. We all come together today right here at this place because we share these core values that every person in our community is important, that every person, every resident deserves access to reach their full potential and deserves health care and deserves the right to access to health care. This latest Senate health care bill is just unjust. It's cruel. It does not reflect the values of Franklin County, the city of Columbus, nor the state of Ohio. We all know this. Access to health care supports people to securely plan for a long and healthy life. Health care enables us all to reach our later years in safety and security. And the current legislation contains cruel cuts that will threaten seniors who rely on nursing homes every day for essential care. It also threatens those of us who one day that will need that support. But this care also enables seniors' family members, their children, and their grandchildren to keep working and contributing to our vibrant Central Ohio community. These cruel cuts also threaten the stability of nearly 7,200 Franklin County residents who have access to this critical health care through Medicaid expansion. For each person who receives health care through Medicaid expansion, the access is key to supporting their families to successfully integrating into the community or to overcoming an addiction issue. We must continue to insist on legislation that maintains coverage for pre-existing conditions for everybody, no exceptions. This is critical And we all know pre-existing conditions in the current bill isn't going to do it for any of us. Nobody should be unable to afford care because of a disability or go without mental health coverage because they lack the resources. And no senior should ever be at risk of losing their home because 50 senators forgot every member of our community is valued. Any legislation that restricts this access is an affront to our shared community values. And that's why we're here today, to continue fighting for what we know is right. This issue is one that we've all, as elected officials, made calls. It's up to now all of you to make calls, and I know that our mayor is coming back up here in just a moment, but I'd like to say too that anybody can reach their elected officials, and it's now time to do that. This is such a critical issue. If you have not got your health care, as we've all said, you don't have anything. And I know my family has their issues with health care, and you know, when you don't have your health care, you cannot focus on anything else. We need you to focus on things that are important to you and your families. It is my proud pleasure to bring back my good friend Andy Ginther, Mayor Ginther, to the podium to give a call to action.
Now you know why I'm with Marilyn Brown. Thank you, Commissioner, for that passionate advocacy and sharing those words. So I want to thank everyone for coming out here today, but today's event is really about one thing: a call to action. We can talk about these things to each other and share ideas and stories of ways that this impacts us, but the bottom line is we need to act. And yes, I've talked to both Senator Brown and Senator Portman about this, but I'm going to call them every day until this vote takes place. They're going to be tired of hearing from me. They're going to be tired of hearing from us, but you know what? This is too important. And if our seniors in our community have taught us anything, we never give up, we never back down. And now it is time for this community, led by our seniors, to stand up and fight for them. We never give up, we never back down. And so I encourage everyone here that has someone that's going to be impacted, or even a friend or a neighbor that will be negatively impacted by this, call Senator Brown. His number, 202-224-2315. Senator Sherrod Brown. Let me repeat it, 202-224-2315. Senator Rob Portman, 202-224-3353. Once again, Senator Rob Portman, who works for us, 202-224-3353. I'm calling them every day. I'm asking you to join us and to make sure that our senators know where we stand and what we believe in. Buckeye values. They're bipartisan. They're common sense. They look out for those who have made this community and country what it is. Our seniors, who taught us never give up, never back down. This is worth fighting for. And our hope is that the next bill is a bipartisan plan that protects Medicaid expansion, pre-existing conditions, and basic health care for everyone. Call today. I know I will. And thank you all for being here. And let's go out and fight for what matters to us most.